Okay, everyone, we're going to go ahead and get started. Good morning. My name is Micah Matthews. I'm one of the National Marketing Directors here at Messer Financial Group. I'd like to welcome everyone. Um, so we've had some previous webinars where we did each individual ACA carrier. I hope you were able to attend some of those. If you weren't, we do have them posted on our website at messerfinancial.com. If you go right here under the Agent Resources tab, you will see that there's a Messer Learning Center. And for those that sell in multiple states, we do have most carriers on here. And if you go back, you can see there will be different webinar presentations. Here's the Cigna one that we just did not too long ago. That was actually on September 23rd. And at the time, we didn't have all the details yet for how competitive and what the market was going to look like for Cigna in South Florida. So we wanted, and not just South Florida, but Florida in general. So we wanted to make sure that we got that information out to everyone as there seemed to be a high demand. So we're very excited to be joined today by Cigna. Karina Gonzalez is actually going to be the one that's presenting. She is the executive down there for the Florida market. So she is going to be a huge resource, everybody. So if you don't know her, I would highly recommend reaching out and introducing yourself, getting to know her, as she is going to be a big resource for you. And again, if you want to go back, if you missed any of these webinars, or if you just want to recap and miss some information and want to watch them again, you're more than welcome to. Guys, it's not too late to get appointed with them. So if you have not done so, please be sure to request your appointment today. As the deadline's getting closer and closer to that 11/1, we want to make sure that you're appointed and ready to go for that first day of open enrollment. As I'm sure many of you are well aware already, this is the year of the opportunity in ACA. A lot of carriers being much more aggressive, compensations going up, a lot of different markets to be shared. So I really see with the new wave of people, with the state of the country right now, with the pandemic and COVID and everything going on, there's going to be a lot of people that are coming off of employer policies. There's going to be a lot of people that may not have qualified for large subsidies last year are now going to qualify. So we've got a huge wave of new people that are coming into the under 65 market, plus with the opportunities in ICRA as well. That's just going to be compounded and bring more and more members. So with the expansion of the carriers, the new competitive rates, the benefits, the richer benefits, it's really becoming anybody's game out there. And we want to make sure that you guys are informed with all the new latest and greatest information that is available. So that's why we're doing this again. I want to say thank you to everyone for attending today. We will have time at the very end for questions. So if you do have any questions, feel free to type those in. We will go over those. Also, for our Spanish-speaking friends down there, we do have that available. We have Spanish-speaking marketers here within Messer Financial that can help you and guide you through the contracting process or any other questions that you might have. At the end of the day, we are here to help. We want to make sure everybody here is successful. So again, I want to thank everyone for your time today. And with that, I'm going to turn this over to Karina. So Karina, it's all yours.
Thanks so much. Hi, good morning, everyone. Need to start sharing my screen. So good morning. My name is Karina Gonzalez. I am the broker manager for the state of Florida. Thank you for that great introduction. I read somewhere, and forgive me because I can't quote exactly where, but I have been, from what I have read, there's going to be 500,000 new lives available in the state of Florida because of the pandemic. So you're spot on. From what I understand, and even if it's half that number, there's business to be made, and there's people that need your help within that ACA market. You're absolutely right. A lot of more people are going to qualify for subsidies, and I'm really excited that hopefully we can continue the wave of getting people insured within health insurance, and happy that Cigna is going to be extending their brand to quite a few more counties this year in Florida. So let's dive on in. The first thing I usually like to start off a conversation with, right, when first time I'm meeting a group of people, is with a thank you. So thank you all so much for the hard work that you do. Thank you for balancing everything that you balance. So when I look at this slide, I think about somebody who is balancing the family life, a social life, maybe, work life, multiple jobs, maybe your school, maybe you're a part-time teacher if you have kids this year, or part-time teacher this year if you have kids. And then from there, you're balancing your own health care. And then on top of that, you're balancing other people's health care. You're guiding them to the right insurance company with the right benefits for the right subsidy and the right copays and the right doctors. And what you do is really important. It takes a lot of work, but you truly are changing, hopefully, the healthcare outcomes for a lot of Americans. So thank you all so much for what you do. On the COVID-19 front, I promise as we get into this presentation, it's going to get more fun as we go. But I'm going to highlight two things on this slide. The first thing is that Cigna is one of the few carriers in the market, in the ACA market, that waived any type of cost associated with COVID-19 as early as March. Right when this happened, we waived costs with testing and we waived costs for treatment. I'm really proud to work at an insurance company that does the right thing without being poked or prodded. The next thing I'm going to highlight is going to be what we're doing as the foundation. So the Cigna Foundation normally donates millions of dollars towards addressing food insecurity, not only in the United States, but globally, and really trying to provide healthy meals to children, like I said, globally. However, this year we have switched our focus towards the Brave of Heart Fund. So this year, the Cigna Foundation donated $25 million alongside the New York Life Foundation, who also donated $25 million, really just to provide that extra support, emotional support, resources, and financial support to Americans who have recently lost a loved one during this time. It's a really difficult time. My heart goes out to anyone here that is having a hard time, and I hope that you're, doing well, and I wish you all the best within your health. I promise, like I said, it'll get more fun as we go. These numbers I think can be intimidating. You see 35% of adults with medical conditions have behavioral disorders, 38% have a chronic condition. Often there's gaps of a couple things within healthcare. I truly believe that with the right insurance agent or agency and the right insurance company, together we can create more access to care, because we're going to provide the right benefits and you're going to educate your clients on all the different resources that Cigna has to offer. And from there we can hopefully, again, create less barriers to care, more access to care, better healthcare engagement. And when we do all of those things, we're going to help people live a happier, healthier, longer life. So I'm going to just continue to truck along here. The first thing I'm going to say is that, so how are we going to create more access to care? At Cigna, we are expanding, as you already know. We're growing in quite a few counties within Florida. And the way that we expect to grow and grow sustainably is by providing an affordable solution on that silver tier. So in the Florida market, you're definitely going to want to look at us in both South Florida and Orlando on the silver tier, really going to provide an affordable cost solution there. The next is going to be that we're going to be a carrier that is predictable, that you can rely on, that when things hit the fan, Cigna is going to be there for your client. My favorite example of this story, I'm a storyteller, so is something that happened to me very recently. So I just started working at Cigna about 4 months ago. I'm not new to insurance, I'm new to Cigna. And within my first month, I had a broker call me and request, they had a client that had a surgery coming up at an in-network provider. So they lived in Denver. They had HCA Hospital approved for their heart surgery. This member could only have this surgery done 6 places in the country. And the best place to have this surgery done was UC San Diego. He lived in Denver, Colorado. So obviously the networks are different, right? State-based networks on the ACA market for the most part. And so I told the broker, hey, I'll reach out and I'll see what I can do. I truly, in the ACA market, I haven't really seen anything like this get approved, usually, especially if you already have an in-network approval, right? And so I reached out to my team on Thursday afternoon. I, provided all the information. By Monday of the next week, that member had the surgery approved for UC San Diego. So again, just an insurance company that continues to do the right thing by their clients on all lines of our business. And we really have those connections network-wise to make those decisions when they need to be made. The last thing I'm going to talk about is going to be what we're providing for you. So we're providing simple solutions for you and your clients. we provided tons of broker surveys, and thank you so much if you did take part in any of our broker surveys last year or this year, really trying to get better as a company on the ACA side. And the biggest takeaways that we had were more silver plans and more copay based plans. So we're going to do exactly that for you this 2021. You're going to see lots of different silver plan options, literally 4 pages of options, and you're going to see copay based solutions. So really going to be providing both in exactly what the broker community asks for, more simple solutions for your clients. So talking about simple solutions, creating more access to care, the first thing that I think about when I think about accessing care nowadays is virtual care. Virtual care, obviously has had a humongous, if that's even the right word, trend upwards, high utilization within virtual care. Lots of people that aren't only high risk utilize virtual care because it's, they can talk to a doctor from home, but because it's terribly convenient. I used virtual care about a month and a half ago at Cigna. I've been a Cigna member for a couple years now, and I love my virtual care benefit because it's $0. So all of the copays on our plans in Florida are $0. So really nice there. And it's not only for the medical health care aspect, it's also for the virtual care. So like I said, I just used my virtual care benefit recently. I have very bad sinuses, but as you know, we are pre-open enrollment. I do not have time to take time off of work right now, right? Because healthcare, Americans tend to not prioritize their healthcare. So my allergies are up, my sinuses were up. I requested a call from a virtual care physician. He confirmed that it's definitely a sinus infection. They see my medical records. I have 1 or 2 a year. And I had my prescription ready for me at CVS within an hour. Again, the whole visit that I just had with the doctor, talking to him over the phone, was a $0 copay. So really nice benefit there. On the behavioral health side, obviously, we're living through a pandemic, and people are really going through a very stressful time. You're seeing spikes within behavioral diagnoses, within stress, depression, grief, loss, etc. And then some of your clients may be battling other things within their behavioral health side. At Cigna, we provide that through a virtual care benefit at a $0 copay. So again, really creating more access to care for all Americans, or all Floridians for that matter. All of our plans in Florida offer both these benefits at a $0 copay. So I could talk about virtual care all day, but I will wrap it up. Not only do I love virtual care, we're really good at virtual care. So as of 2 weeks ago, this is a study that just was released by J.D. Power and Associates, reviewing, the best in overall customer satisfaction within telehealth. As you can see, we are ranked number 1. Really proud of that. We beat Kaiser, and everyone on this call knows how hard it is to beat Kaiser within customer satisfaction surveys. So really excited that we're continuing to break ground and set standards here at Cigna. We've surpassed Kaiser, we surpassed United segment average, and Blue Cross and Blue Shield, right? So really great competitor within the market on our telemedicine benefit. You can expect your clients to be incredibly pleased, I think, with their service experience. At least I am. Okay, so now I'm going to dive into some of the programs that we offer for 2021. This program is a brand new program. It actually launched in September of this year, and is called the Cigna One Guide program. This program is a new program, like I just said, and we designed it through practicing predictive analytics. So at Cigna, we have over 180 million members. And so what we did is we take that secure data, and that way we're able to analyze people's choices and behaviors to see what the next steps may be within their healthcare, right? So for example, a really simple example is, if somebody is utilizing urgent care the wrong way, and I'm sure you all have a few clients that may be doing urgent care as Band-Aid care, right? So my example is, if my aunt went to urgent care 3 times for a stomach issue, that would trigger One Guide to reach out and help find the right provider for her. So really, give her a call, which is a different type of experience, and try to understand, what exactly is going on, and help guide her to the right care. Obviously, that's in network, and that's a highly reviewed provider. The next thing is going to be as simple as when you call into Cigna. So when you call into Cigna, we're not only answering, the question that you're asking, but we're kind of diving into why you're actually calling, what the deeper reasoning may be. So for example, going back to my allergies, I love talking about my allergies. I hope somebody on here has allergies too. So talking about that, let's say I called and asked, what's the copay for my ears, nose, and throat specialist? The response would not only be obviously what the copay is going to be, but also what providers are in network. They would email me or offer to email me providers within my area if I was interested. It's open-ended conversation, which would probably guide them to realize that I need to actually get my allergy testing done, and then find me, locations where I can get that done, again, in network or preferred. And so now I would realize that maybe I should just get the allergy testing done, not see an ENT, and avoid that extra copay, and really, again, avoiding waste within the healthcare system. So really nice service experience on both ends, through our practicing of predictive analytics. This program is my favorite program at Cigna. This program has my heart, and I think it'll have yours as well. It's been existent within our commercial side of business for years, and we brought it over into the ACA market, I think a few years ago. It's not new to IFP, but I do think that we never really talked about it. So it's called the Personal Champion Program. The Personal Champion Program is designed for people who have really complex medical issues. So some examples of that is maybe somebody who just got diagnosed with cancer, someone that is regularly taking a tier 4 medication, maybe like an HIV medication. And the last thing is going to be perhaps somebody that, just delivered a baby prematurely. So mom and baby both need extra help. They need that extra support and service. And so every time that they call Cigna, they would have a one-on-one relationship with our healthcare advocate. That advocate would not only, guide the member and the, baby to the right hospital systems, they'd also guide them through the insurance system, because as we all know, healthcare can be kind of, saying the least, confusing. And then from there, we also provide additional resources, not just an advocate or a champion for your client within the healthcare system, but within the community. So for someone that recently got diagnosed with cancer or is battling cancer, finding community support groups and different types of resources within the community that may just make life a little bit better. So really a full service experience and a one-on-one relationship for those members and clients of yours that are really balancing some heavy, complex medical issues. This program is not a program that you can sign up for. I think everyone would sign up for it if that were an option, right? To have that one-on-one relationship. It's a program that we offer, based off of people's medical records and history and, information that we have, obviously, that would be an invitation extended to the member. I will say that over 50% of our members at Cigna receive case management. So a lot of the members at Cigna can probably, if you know of somebody, can speak to the service experience that we truly do provide to our members. Now, this is really, really exciting. This is, so we are offering a brand new plan. It's called the Cigna Connect Diabetes Plan. It is on the silver tier. It is eligible for subsidies. And I've never seen a plan like this on the ACA market. It is an incredibly rich plan. It's almost like a Medicare plan. That's how rich it is. So it's called the diabetes plan, and if you're already looking at the bullets, you're probably already impressed. So at Cigna, we actually have two programs specifically designed for diabetics, and the reason that we are, really trying to provide that extra support is because there's like over 30% of Americans that suffer or are diagnosed with diabetes. So really trying to provide a more affordable solution to people that really do need that extra help. So the first program I'm going to talk about is the Patient Assurance Program. The Patient Assurance Program has been around at Cigna. It started last year, so the beginning of 2020, and it provides insulin at a flat $25 monthly copay. Really, really nice. And then as you can see, we also offer on the Connect Diabetes Plan, there are extras. So the biggest difference here is that the Patient Assurance Program really caps the cost of insulin or other diabetic medication. Granted that it's on our preferred brand insulin list, but that list is about 3 pages long. So it's a really nice long list that once we have, we'll send over to Mercer so you guys can have it handy dandy in your portal. But again, so the Patient Assurance Program is on all of our plan designs. It provides insulin at a capped cost. There's no deductible, applied to that insulin copay. And then they also provide on the Patient Assurance Program for all of our members on every single plan, $0 copays for labs and exams, for management training, and for some equipment. Now, if your client utilizes or uses an insulin pump, if they use the pump, then they're going to want to look at the Connect Diabetes Plan. There's a specific plan on the ACA market. It says diabetes in the plan title, and that covers the pump on the plan for $0 copay. The Patient Assurance Program, which is on all of the other plans, doesn't cover the pump. So those are the only really big differences to make it crystal clear between the diabetes plan and versus the assurance program. So you have 2 options. If that's confusing, we'll have time for some Q&A at the very end. The rewards program. So at Cigna, we love to provide our members rewards. So we actually have 2 rewards programs that I'm going to talk about right now. The first one is going to be the Take Control Rewards Program. This is a brand new program that we are launching. It is an exclusive program for the Floridian community, and it's going to be limited. So I think the first 20,000 people that sign up are invited can partake. All of your members in Florida will be invited. They're going to get an invitation in the middle of January. And basically what you're doing here is you're earning points. So as a Cigna member, you can earn points, you can complete your wellness exam, you can do the My Cigna app, you can learn about your benefits. So when you do all of those different things, those points will translate into rewards. So like an Instant Pot or an Echo Dot, and there's different rewards, and that'll all be, emailed to your client in the middle of January, just inviting them to this new program. So really excited. Again, this is going to be just in Florida and a few other states, but Florida is the lucky market that gets to try out this program. I'm sure that we're going to get a lot of people signing up, and then we'll probably break it into a national program. The next thing I'm going to talk about is the discount programs that we offer your clients for both dental and medical. So any Cigna member has access to these discounts. I have access to these discounts. They're really nice. So first discount I see, ironically, is the LASIK. I actually need to get LASIK. Discount on glasses, discount on meal delivery services. You get discounts on the workout Diam yoga mat. You can get discounts on the wearables if your client likes to track their steps, gym memberships if you're in an area that gyms are opening up again, and last but not least is discounts on the Daily Burn app. That's going to be a really cool fitness app if you're working out from home, to have a virtual workout, right there from home. We're almost at the medical. I hope you're just as excited as I am. So we're at the dental. We offer dental in all 50 states at Cigna. You can write your dental directly from your broker portal. We do provide an auto issue within 24 hours, and all of our dental plans are PPOs. So we have 3 dental plans that you can sell. If you're already appointed in Florida with through Mercer, you're going to be able to see that you'll be able to sell dental. So it's one in the same appointment process, to make that super clear. So if you're already appointed for standalone medical, for IFP or ACA medical, you're already appointed for dental. It's one in the same appointment process. So the first plan I'm going to talk about is going to be the Cigna Dental Preventative Plan. That plan is obviously the most affordable plan. It provides that basic coverage for anybody who's just looking to have a couple appointments a year. If you step yourself up to the 1,000 or the 1,500, you're going to see that there's a little bit richer benefits, and you can waive the waiting period on class 2 and class 3 if your client has had previous coverage for a full year. So if they've had a full year of previous dental coverage, as long as it's not a discount plan, we can waive the waiting period for class 2 and class 3. The last thing I'm going to point out is the dental 1500. So on the dental 1500 plan, you're going to see that we offer orthodontia for adults, which is pretty awesome. And you can waive the waiting period on orthodontia you cannot waive, and it's a full year waiting period. You can waive the class 2 and class 3. You can't waive the orthodontia benefit. And again, one last reminder, they are all PPO plans. We do have 97,000 plus, preferred dentists. And if you stay within the preferred, you won't get balance billed. But I know a lot of dentists are independent. So if you want to go to your independent dentist, you can, and then you can submit the claims right on these PPO plans. So really nice benefits here. We are at the medical. So we are expanding, as you already know, in Florida. So the stars indicate that we're expanding into new counties. We are going to stay in the same 10 states that we were in last year. We're just growing our footprint in a few of these states. So in Colorado, we're going to be expanding into Fort Collins, Greeley, Colorado Springs. In Florida, we're expanding into Palm Beach. We are in Palm Beach and Collier. We are expanding into Leon, so it's Tallahassee. We're expanding into Orlando, so Lake, Seminole, Orange, and Osceola County. And then down in South Florida, we're going to be expanding into Broward. I hope you're as excited as I am. And the Treasure Coast, so Indian River, Martin, and St. Lucie. For Illinois, we are going to be providing a brand new network. I'm sure you've already heard that we have a great thing going with Northwestern. And then in North Carolina, we are expanding into 300 counties, I think, or 52 counties total. We're expanding into something interesting. But anyways, about 52 plus counties in North Carolina. And then last but not least is going to be Virginia. So Virginia, we're expanding into Spotsylvania County, which is Northern Virginia. Again, if you sell in any of these states and you want to get appointed through Mercer, please reach out to them so that way they can get you appointed. And then let's talk about what's going on in Florida. So in Florida, we, as I have mentioned, are expanding in Orlando County. And we're going to be in Lake, Orange, Osceola, Seminole. We are expanding into Broward, and we are removing the referral. I'm really excited about the removal of the referral. I think that it's going to be a great year for us in Florida. Again, we're strategizing on that silver tier. You can see we have 5 silver on and off plans available. Really going to, try to provide the market some awesome plans. So let's dive into our network before we continue. And so our network partners. So the first partner that is standing out is Orlando Health. We are partnered with Orlando Health in Orlando. And then in South Florida, we are partnered with Memorial Healthcare System and Cleveland Clinic. Only Florida Blue is partnered with Cleveland Clinic, and for Memorial, only Florida Blue and Molina. So what you're going to see here, I think, is that we're going to be probably one of the more cost-effective ways to get to both Cleveland Clinic and Memorial Healthcare System. And then on Orlando Health side, we have both Orlando Health Physicians Associates, and we have both family and primary groups associated with Orlando Health. We have all facilities within the counties that we serve. We have all Cleveland Clinic facilities. We have all Memorial Health healthcare facilities within, again, the areas that we serve, and then that's the same exact thing for Orlando Health. So these partners, I think, are really excited to work with us. I know Orlando Health is even going to be doing advertising for Cigna because they're so happy to have us on the ACA market. I expect to do some really great things throughout the state of Florida. And then just again, to remind you, no referrals, and it's a state-based network. So if you live in Orlando and you're coming down to Broward, or you're coming down to the Treasure Coast, you can access Cleveland Clinic, and vice versa. If you live in South Florida and you're coming up to to Orlando, you can access Orlando Health. Providers. So the first thing I'm going to talk about is going to be, the provider lookup tool. It's super easy, cigna.com/IFP-providers. You'll be able to find this also on your broker portal. The providers are not going to be loaded yet. We will probably have them loaded, I hope, by a couple days before November 1, so you can poke around and take a look. If you have any suggestions within the provider world that have, privileges to some of our in-network facilities like Cleveland Clinic, Memorial, or Orlando Health, those providers are easier to get contracted. Obviously, if you called me or emailed me about a provider that only works at Miami University, it's not going to probably be as easy. And then just to make that super clear, since I'm diving into that conversation, we are not entering Miami-Dade. Plan design. So I'm really excited about what we're doing, even on the bronze tier, because if you look at Cigna Connect 7000, this is for someone who doesn't have a subsidy. They have an uncapped PCP copay. So again, it's $35 flat, unlimited special primary care copay. And then you can see it continues to drop on the 5,500 plan. It's as low as $30. All of these plans, the 7,000, the 6,500, and the 5,500 have a flat urgent care copay, which is really nice. And then if you look at the very bottom, it shows formulary diabetic supplies and metformin all at $0. So really nice there. If you have a client or clients with diabetes, make sure you quote Cigna plans to them, because you could end up saving them lots of money on the prescription drug side. Okay, so here are our silver plans, like I just talked to you about. I'm super excited. The base plans on our silver plans, again, are really, competitive. You have uncapped, again, PCP copays. A lot of carriers come in with these 2Z, 3Z rules. With Cigna, you can go to the primary care office more than 2 or 3 times, as many times as your client wants. And then last, obviously, is going to be that pre-deductible specialist copay. Really nice. I think the $7,200 for someone who's not subsidized on the silver tier is going to be a really affordable price point. You have a PCP copay, a urgent care copay, and a specialist copay, all pre-deductible. And then if you shift over to the 4,500, you can see that there's an emergency room copay. Now, for people who've been in this business a long time, we all know how great an emergency room copay is, even if it is after deductible, because unfortunately, if you spend 1 or 2 nights at the ER, that's a $20,000 bill. So to have your, cost for your client capped really provides a lot more security. And so if they can afford to go up a little bit within that deductible range to the 4,500, again, a $650 emergency room copay is really nice. Now we are going to talk about the off-marketplace only plan. So we are offering 2 off-marketplace only plans. These can be sold on your broker portal. So first is the 5,750 and the second is the 1,900. Really rich benefits, right? These look like group plan benefits. So it's really awesome for maybe somebody who's selling group, they're selling ICHRA to a group. Obviously you can sell all plans on ICHRA, but these plans are really nice because you have a really low PCP and specialist copay, pre-deductible. Urgent care is lower than most of our plans. They're set at $55 and $40. Again, these are only available on the broker portal or directly, so they're not available with a subsidy, is I guess what I'm trying to say. They're only available off marketplace, just to make that crystal clear. And again, really great for somebody who can afford a little bit of, afford a plan without that subsidy, but looking for some richer benefits. Now I'm going to go into cost share reduction. As we all know, the majority of Florida are on the CSR plans, right? So let's start diving into those. So you have the 03 and the 04 plan. Urgent care is set at $25, and then you can see it drops down to $20. You see it $5.35 for PCP specialist, 0 and 5, and this is for the 6,000 base plan. These are with cost share reductions. Now we're going to dive into the 7,200 and the 4,500. The 4,500, look at that, 0 and 10 bucks for specialist on the 4B plan. If your client qualifies, these 0 plans are looking really nice. 0 deductible, 1,500 max out of pocket, $100 ER copay. That 0 4B plan is going to be hot for sure. And then you're going to take a look over here at the 1,903 and the 654, just as competitive, 0 and $5, zeros all the way through, and 20 bucks for urgent care, a 650 deductible. But again, you know, 650 deductible versus, you know, it all balance out. So lots of plans, like I mentioned in the very beginning, I wasn't kidding. So make sure you take a look and you know, really poke and prod through these plans, because you're going to want to know your favorites for your clients before OE. The 3,500 and the diabetes care plan with cost share reduction. So the 3,500 and the 3,500 diabetes care plan are not exactly the same. They have different specialist visits, and obviously, again, the diabetes care plan offers insulin pumps at $0, and different insulin benefits and care solutions for diabetics on the diabetes care plan. If your customer is not diabetic, then maybe the 3,500 is a better fit. The reason I say is because there are flat specialist copays. This is for someone with a little bit less of a cost share reduction, less subsidized than some other folks, but still wanting those you know, awesome benefits, $5, 15 bucks, 25 bucks for urgent care, you know, really nice benefits. And the last one is going to be the Native American plan on the far right for the $0 copays through and through. Just to make that super clear, that's what the NA is for. Okay, and the gold plan. So we still are offering our one gold plan. It's a 2,000 deductible. You're going to want to compare it to the off exchange silver plan. It's really similar. We actually have that off exchange silver plan with a 1,900 deductible. So you want to compare that with the gold 2,000. I know that there are some shoppers that really need to have gold on their card, but you know, if they look at the silver, some of the silver plans are just as rich. You're going to see, again, super low urgent care, PCP specialist. I'm really excited about the PCP and specialist, you know, having those uncapped and pre-deductible, really big wins and easy to sell. I think your clients will see that there's an obvious value. Even if we're priced $10 more, our benefits are really just competitive and the network is just as strong. So let's talk about your broker portal. So when you log into Cigna for Brokers, the first thing you're going to see is the beautiful blue quote and enroll button. You can click on that and you can write business directly through Cigna, so off exchange, as well as streamline it on exchange. You can take a look at the bottom where you can find providers. You can take a look at your medications, where you could find at medications that are, you know, 90 days, for example, or what the cost is going to be, what tier, what's our preferred pharmacies, etc. If you click on the very top of your broker portal, there's a button that says Resource Center. On the Resource Center button, you'll see something drop underneath that says Documents and Forms. Under the documents and forms, you can find marketing materials. So you'll find marketing materials with summary of benefits. You'll find customizable flyers. You can add, you know, your own information to these flyers and provide them to your client once they're done with their sale. También tenemos recursos disponibles en español. Si quieres poner su información aquí en este cajita anaranjado encima del folleto, perfecto. Puedes poner nombre de su compañía, puedes poner su número de teléfono, correo electrónico, cita de web, cualquier cosa encima de nuestro folleto con la marca de Cigna. Aquí, I think together we look really good. You know, putting that logo next to your information is awesome. We also are going to have these available in Vietnamese, Korean, and Chinese. All right, we are coming to a close. So if you need help, I've had so many conversations with brokers that maybe were appointed years ago, you're still showing active, you got a few floaters on your book of business, and you can't get into your broker portal. So if you need to reset your broker portal, we're happy to help. Our broker support phone number is right here, but they are getting pretty slammed. So if you need any other help, we have here Nicholas Cayopa's information. He is the broker manager at Cigna. for your general agency. So the phone number right here is 845-857-7662. He's better to contact via email, and I'll put that in the chat box for you right now. Any other questions? I'm going to actually just leave this up for you.
Karina, that's some great information. I just want to point out a few things as well. The landscape of the ACA is different than it was just a few years ago, and what I mean by that is there was a time when the mandate was in place where people were just getting insurance because they had to, otherwise they were going to pay a penalty. Well, that's not the case anymore, right? So these people are actually buying insurance because one, they need it, and two, they care about their benefits. And with everything going on with the pandemic and everything else, it is becoming more and more clear that benefits are now becoming more important than just premium. So yeah, we all love to sell the zeros, right? That's an easy sell, get them in and out, and that's very fast. But I got to tell you, do yourself a favor and actually spend some time when you're going over at the point of sale these benefits. Make sure that these are ones that they actually understand that they want these benefits, because even if it's a little more, they're going to see the value in that, and that's going to save you a lot of time on the back end. Because guess what? If something happens to them and they find out, oh well, man, this plan doesn't cover anything that I need, guess who they're going to come back at? And it's going to be you, the agent, and you're going to end up losing that business. So we're in insurance because of the residuals, is because of helping people, because of the relationship aspect of it. Don't ever forget that. I know during the OEP that it's go 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 the whole time, and you're just trying to get things done. But like I said, do yourself some service and your clients. Do what's in their best interest and really go over it. Take some time to explain those options to them, the different options, and not just the zeros and what's the cheapest plan out there, because people do care about those benefits. And it sounds like with all the added benefits that Cigna has brought on their plans, I don't see any reason why they wouldn't be a terrific fit. I mean, some of these benefits are just tremendous. So, I mean, why do we sell insurance? Why does a healthy person have insurance? It's because they want to be protective if something catastrophic were to happen. And I got to tell you, I know a lot of us deal with the low income folk, and that's who are getting these plans. But look, if something happens to them and they still can't afford it, even with the insurance, then they might as well just been throwing their money away the whole time, because the insurance was worth nothing. The number one, uh, the largest factor as far as people going bankrupt are health benefits, not having the correct benefits. So do the right thing for your clients, and it's just going to help you in so many different ways all the way through that relationship. Also, just to point out about the teledoc, that is an amazing service. For those of you that have not tried it yet, I always give this example. My daughter, she had pink eye, and instead of having to call our primary care physician and wait and maybe wait 3 or 4 days to even get in, we were able to call someone, speak to a physician within 15 minutes, and then they called us back and they did a whole video chat with her. They got to see her face. They were asking her questions. They diagnosed her as having pink eye. They sent the prescription over to the pharmacy, and within an hour, I had the prescription. So again, guys, that is the future. I see it, and I think everybody else is seeing it in healthcare. Is this teledoc? I mean, those people that are very sick, unless it's an absolute medical emergency, they're actually encouraging to stay home. So what better way than to be able to stay home but still be able to have that peace of mind that that you spoke to a physician, someone who knows the ins and outs of your health and can really help you with there. So I think those are all great points. Sounds like that's exactly what Cigna is addressing, and really what's going to be the future of the healthcare. Because if all you're doing is selling price, you're going to lose in the long run. I assure you of that. That's in anything. You're just doing the quick way out. So I don't see really any questions here, but Karina, this was great information. I think they're pretty clear on this. I know that this will be posted on our website next week, so if you want to go back and review this as well. Do you have any idea when is this available now, Karina? Is this something that we can send out, these plan benefits?
So we have one little error here. Unfortunately, the marketing team forgot to put Broward in this plan design comp. So once I get those fixed, I think I'll have them hopefully this week. I'm happy to send you over this slide deck.
Terrific.
But I can send you all the other content.
Wonderful. Okay. So yeah, and obviously we don't know exactly what the rates are going to look like, and we won't know until right before the OEP. So really the main point for what you guys should be doing now is number one, most important is make sure you're contracted. If you're not, let's go ahead and do that. And then two, just familiarize yourself with these plans, these benefits, the network, so that whenever it does come time, then the rates really don't even matter anymore because you've already determined, based off of what your clients are needing, who they use as their providers, et cetera, what prescriptions they're on, what kind of coverage they're looking for. You already know which carrier, then it's just a matter of telling them what the cost to them is going to be. So again, that's all I have. Karina, is there anything that you wanted to say in closing?
Honestly, I just wanted to again say thank you all so much. I think you recapped everything perfectly for me. Thank you for your time. Really excited to grow with Messer. And I wanted to say, yeah, I think that you're absolutely right. We're really going to be creating, hopefully, less boundaries, more access to care, and awesome solutions throughout the state of Florida.
And Karina, I'm sorry, there actually was one other question. They were asking, do you know if Cigna has any plans to expand into the Tampa area? And if so, will you also be in Polk? Any indication on that?
We're not going to be there for 2021. It's not off the table for 2022. I think the idea is that we'd like to get into Tampa and Miami-Dade in the near future, but we have to kind of build something within Broward and Orlando first.
All right. Well, again, thank you, everyone. This webinar will be on our website next week. Reach out to us at Messer Financial directly. If you have any questions, concerns, or anything in regards to your contracting, we'd be happy to help you and walk you through that process. Karina, I want to thank you again. And everybody out there, stay safe and have a great OEP. Thank you, everyone.